This is WFYI News Now. It's August 2nd, and I'm Abriana Herron. On today's show, dramatic changes at IPS as students return to the classroom, and an effort to help child welfare workers with mental health conditions.
Any way that we can help them process through the things that they see, I think will help us ensure that they can bring their best to the table every day.
Those stories coming up, but first, the next installment of our regular segment called The Checkup from Side Effects Public Media, where the health reporting team explores a single question sparked by a recent news story or maybe by one of our listeners.
1/5 of adults in the United States have a mental illness, which makes them a lot more vulnerable to police violence. In fact, they're 16 times more likely to be killed during police encounter compared to others without mental health issues. So, when these people are in crisis or need help, who should they turn to? And how is our crisis response system taking care of them? That's the Checkup's question for today. I'm Lizzie McGreevy, Community Engagement Specialist with Side Effects Public Media, and with me is Ryan Levy, producer with the health policy news organization Trade-Offs.
Hey there, Lizzie.
Hi, Ryan. So you just produced a series called The Fifth Branch, and it's looking at the crisis response system and how it responds to people with mental illness. Can you tell us what is the fifth branch in this case?
Yeah, so most people are familiar with the standard 4 branches of public safety, right? You've got 911 answering the call, and then police, fire, or EMS responding. But there are a lot of reasons that people call 911 that aren't good fits for police, fire, or EMS. So the idea of the fifth branch is a different type of response that 911 can send out. So this would be unarmed mental health workers who can respond to nonviolent 911 calls involving things like mental health, homelessness, and addiction.
So unarmed crisis response teams, that's not really a new concept. It's been around since the 1980s here in the U.S., but for some reason, it feels like there hasn't been like a huge, real commitment to this mission. And I say that because we hear time and time again about police killing people going through mental health crises. Can you talk about what your reporting found in terms of the challenges the concept of non-police response is facing?
Absolutely. To many people, this is just a radical idea. Sending someone other than a cop, firefighter, or a paramedic to a 911 call just doesn't compute for some folks. Is it safe to send unarmed civilians to 911 calls? I will say the evidence so far strongly suggests that it is. And of course, trying to stand up a whole new public safety branch takes a lot of resources. But I will say we are seeing more cities take this on. You have these programs in more than 100 communities across the country, including more than half of the country's largest cities having some kind of unarmed 911 response.
I am excited to say that here in Indianapolis, which is where WFYI is, the city did launch a new crisis response team made up of clinicians. That's called Clinician-Led Community Response here in Indianapolis. And that started a year ago, so July 2023. So happy birthday, CLCR. So a lot of places have a form of this crisis response team, like you said. But it kind of feels patchworky. How do we measure the performance or the success of these programs?
Most of these programs are just a few years old, and a lot of them still have limited hours or only cover certain parts of town. So that's all to say, this is still small, this is still new. The main metric that most cities use so far to kind of measure their success is how many calls they've diverted from police, removing that chance for an arrest or a violent police interaction. Other metrics that could tell us more are, what impact these programs are having on things like arrest rates, police use of force, access to long-term treatment. But those are a lot harder to tease out and study because there's just a lot of things that can impact those. So researchers are doing that work right now in Durham and a few other cities, but that's going to take a little more time, and hopefully we'll know more about these other impacts soon.
So the full series of The Fifth Branch is out now, and you take us to Durham, North Carolina. You rode along 911 calls, shadowed the staff, the whole 9 yards. Why did you choose Durham, and what is something that really stuck with you as you were doing this kind of reporting?
Yeah, so picking Durham, it's one of the most robust programs in the country, alongside places like Denver, Albuquerque, and Eugene, Oregon. And they were willing to give us a lot of access, all that access that you mentioned. One thing that stood out was just how people responded to this different kind of response. I sat with multiple people who were reduced to tears because they felt cared for in a way that they just never had before by a first responder. On the other side, though, it also became clear in my time there, just kind of how limited this fifth branch is and the limits of what they can do for people. Because people have, the folks they're interacting with have a lot of needs, food, money, housing, mental health care. And all of that is in short supply. And I think it just shows how big the needs are, how many gaps there still are in our social safety net, and the limits, at least now, to how big of an impact these types of programs can make.
Ryan, thank you so much for this wonderful information. You can listen to all 3 episodes of The Fifth Branch now and learn more about the series at tradeoffs.org/thefifthbranch. If you listeners have subjects or questions for the checkup, let us know and we'll cover it soon. Until next time, stay safe.
That was The Checkup, a segment from Side Effects Public Media. Side Effects is a regional health reporting collaboration of NPR member stations across the Midwest. It's based here at WFYI. Students in the Indianapolis Public School District return to class on Thursday. This year, there are dramatic changes, including reopened buildings. WFYI's Eric Weddle has more.
Broad Ripple and Thomas Carr-Howell high schools have been closed for several years, but they reopened today for students in grades 6 through 8. The new middle schools are part of a sweeping change to grade configurations and curriculum at IPS. In addition to those, the district will have 5 other directly managed 6 to 8 middle schools. That means elementary schools will now be for grades K to 5. In a message to families, Superintendent Alicia Johnson says students will now get the same courses and activities at each school.
For our students in middle school, they will all have the opportunity to engage with music and to take computer science. And for those who are ready, have access to Algebra 1.
Previously, not all IPS schools offered the same math courses or extracurricular activities. I'm Eric Weddle.
And for our final story today, up to 50% of child welfare workers are at higher risk of developing secondary traumatic stress or related conditions, according to the National Child Traumatic Stress Network. Indiana Public Broadcasting's Tamoria Cunningham reports on a new program that provides wellness support for child welfare workers in an effort to combat mental health conditions.
The Worker-to-Worker program provides frontline staff at the Indiana Department of Child Services access to a free and confidential hotline. This hotline allows current DCS staff to speak with trained and retired DCS workers. Sarah Sailors is a Chief Deputy Director at Indiana DCS. Sailor says the work the frontline staff does on a daily basis is difficult and can be traumatizing.
Any way that we can help them process through the things that they see, I think will help us ensure that they can bring their best to the table every day.
Indiana DCS partnered with the National Center for Peer Support and Rutgers University Behavioral Health Care to launch this program. The hotline is available weekdays from 8:30 a.m. to 5 p.m. Eastern. For Indiana Public Broadcasting, I'm Tamoria Cunningham.
That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back on Monday.